Great. Thank you so much for the introduction. So focused ultrasound is becoming increasingly used for non-invasive transcranial therapies in patients. In the setting of thermal ablation, where tissue heating is the clinical goal, MRI is an ideal modality for temperature monitoring because there are a number of MR parameters that are sensitive to temperature changes during these procedures. Unfortunately, MR guidance, while MR guidance permits treatment monitoring during thermal ablation procedures that are nominally performed at very high acoustic intensities and high acoustic duty cycles, there are fewer developed tools for target localization prior to procedures that occur at nominally lower acoustic intensities and lower acoustic duty cycles, such as those for neuromodulation and blood-brain barrier opening. So the goal of this study was to develop a tool that can help us confirm how ultrasound is being delivered to the brain prior to these transcranial therapies. So to solve this problem, our group is developing an optical tracking guided MR-ARFI pulse sequence, or MR acoustic radiation force imaging pulse sequence. Essentially, this pulse sequence uses diffusion or motion encoding gradients that are synchronized with the emission of a focused ultrasound pulse to visualize the transient tissue displacement that is caused by the ultrasound beam's radiation force. So due to its micron scale sensitivity, MR-ARFI is a promising tool for guiding those procedures that are performed at nominally low acoustic intensities, like those for neuromodulation. And we use optical tracking neuronavigation to further, to first estimate the location of the ultrasound beam prior to performing our MR-ARFI acquisitions and maximizing our sensitivity to displacement. So our MR-ARFI pulse sequence was implemented on Vanderbilt's high-field 7 Tesla human research scanner. Our ultrasound sonications were performed using a spherical single-element FUS transducer operated at 802 kilohertz for 4.5 milliseconds. Our acoustic intensity parameters are denoted there and were designed to closely mimic what we currently do for our ongoing ultrasonic neuromodulation experiments in non-human primates, a macaque model. And that's shown in the image on the right there, which is under optical tracking guidance with our optical trackers and an optical tracking camera. So our MR-ARFI pulse sequence is illustrated here. For the sake of time, I will not go through this in great detail. But our encoding gradient duration was 3 milliseconds, which closely follows our sonication duration, operated at maximum gradient strength, and ultimately we got a acquisition time of 4 minutes per MR-ARFI image. So first, we used optical tracking to estimate the location of the ultrasound beam. Essentially, what our optical tracking workflow allows us to do is overlay or project free field ultrasound beam information onto pre-acquired MR images of the macaque's brain, which you can see on the left over there. And ultimately, what this allows our preclinical investigators to do, as they're manually targeting and manually steering the ultrasound transducer, is target the ultrasound beam in the desired brain region of interest, as the transducer is being tracked by the optical tracking camera. So after we targeted the S1, which is the circuit of interest for our group, what we did was acquire MR-ARFI images, displacement images. That's shown on the right over here. So here are two representative MR-ARFI displacement images. So when the focused ultrasound sonications were turned on, we see the acoustic focus clearly visualized in the targeted region of interest with a peak displacement of about 1.2 microns. In a separate control experiment where we turned off focused ultrasound, we did not see any displacement observed in the image. So sort of as positive controls, what we did was we increased the input power to the transducer, which would increase the generated transcranial pressure. What we saw was that the displacement increased with the input power, which is expected since the displacement is thought to scale with the local acoustic intensity. In separate ex vivo experiments, we further replicated this result. For the sake of time, I won't go through these in great detail, but really what these experiments are trying to show is that some sort of neuronavigation is necessary to first estimate the location of the ultrasound beam, particularly for single element transducers, which are manually steered and manually targeted the region of interest. And we use this information to prescribe our MR-ARFI scan parallel to the beam. And we repeated this in a number of different transducer orientations to further show how our sensitivity to displacement could be maximized using a navigation method like optical tracking. So just in summary, we're proposing that our optical tracking and guided MR-ARFI sequence can be used to achieve image-guided ultrasonic neuromodulation in the in vivo setting. Indeed, this does translate to other applications of transcranial focused ultrasound, like blood-brain barrier opening or even thermal ablation, and also extracranial applications of focused ultrasound. And just looking forward, we're looking to further optimize our sonication choice as well as our sequence parameters. And besides circuit localization, really the holy grail for our group would be using MR-ARFI derived intensity feedback to compensate for aberrations that occur to the skull. And we have a phase array system that we intend to use for that. And we'd just like to acknowledge the Focus Ultrasound Foundation for inviting our group to give this talk, as well as all the many laboratories at Vanderbilt that are involved in this project. I'd be happy to take any questions.
Looks like we may have a question or two.
So when you showed the displacement with pressure, you showed us a linear relationship.
Sure.
But you also said you expected it to go linearly with the intensity.
Sure.
So shouldn't there be a quadratic relationship with pressure?
It should in fact be a quadratic relationship. So these are kind of very preliminary results that we need to replicate in further non-human primates. I don't have a good reason for why the displacement might scale linearly, what appear to be linearly with pressure, but we would in fact expect it to scale it with intensity,
Right.
linearly.
Right, yep, thanks.
So we're still looking into it, basically.
So in the plots you showed, to get the 1 micron displacement, it was like 3 megapascals, which is about 1 order of magnitude more than the threshold for neuromodulation.
Sure.
Is your sensitivity good enough, in order to basically get the ARFI maps at a level that is sub-threshold in order not to create adaptation and to inform the animal of the stimulus?
Sure. So we're probably not intending to use this during the neuromodulation pulses. Is that the question you're asking? If
the
you could
question
use this,
is, what is the lowest level that you can detect with your ARFI?
So with the current sonications that we're using here, the lowest displacement we can probably detect is about maybe half a micron. But if you're asking what the lowest number of sonication cycles that we can use for us to detect?
No, what's the lowest pressure?
Oh, lowest pressure. Oh,
yeah, because you were using 3 megapascals for the.
So the 3 megapascals was the free fill pressure. We would expect the transcranial pressure to be about 50 to 70% of that. Well, yeah, more like 30%. But yeah, sorry, I can find you online and talk about that.
One last question.
Just quickly on the optical tracking.
Yeah.
Was there any reason to do both the optical, but you're already in the MRI magnet where you can just geometrically see the transducer and place the focus with the MRI images. So what was like the advantage of also having the optical? Yeah,
sure. So certainly you could just use plan off the MR images. Really the point here was to use a more robust method to target the region that you actually care about. Particularly since we're manually steering this and manually positioning the transducer. And this is all done outside of the MR magnet. I should maybe be more specific with that. So outside of the MR magnet, we target the ultrasound beam to the brain regions of interest.
Great, thanks so much.
Cool, thank you.
Thank you. Great.